Hello, everyone. Thank you for joining us for this Keystone Symposia ePanel discussion on the impacts of climate change and human health. I'm Thale Jarvis, Chief Scientific Officer at Keystone Symposia, and I'd like to welcome you to this event. Keystone Symposia has a long history of programming outstanding events in the life sciences, largely focusing on the underlying molecular and cellular mechanisms that drive fundamental biological processes involved in health and disease. This ePanel is a collaborative initiative with the Global Consortium on Climate and Health Education. This is part of a series of virtual events focused on specific aspects of climate and health, and arises from a broad recognition that climate change is a growing contributor to a variety of health-related concerns, from air quality and respiratory health to infectious disease and heat stress. We also recognize that these health impacts fall unequally across various populations, raising concerns about health equity and the need to build resiliency in our healthcare systems to address systemic inequities arising from climate change. This ePanel series is part of a larger initiative at Keystone Symposia to lower our carbon footprint and democratize access to compelling scientific content through an expanding offering of virtual content. With that, I'd like to welcome Cecilia Sorensen, the Director of the Global Consortium on Climate and Health Education.
Hello, everyone. Good morning, good afternoon, and good evening. We are delighted that you are joining us here today for this ePanel series on climate change and health. My name is Cecilia Sorensen, and I am the Director of the Global Consortium on Climate and Health Education. Our mission is to ensure that 100% of health professionals globally have the knowledge and skills to prepare for and respond to the climate and health crisis, as we know that impacts are already happening and affecting the most vulnerable patients and communities globally. The GCCHE was founded in 2017 at the Conference of Parties in Paris, and today has grown into a vibrant community of over 300 health professional schools from 50 different countries, all who have pledged to train their students in climate and planetary health. We represent schools of nursing, medicine, pharmacy, public health, social work, dentistry, and veterinary medicine. We are so delighted to be partnering with the Keystone Symposia to bring you this ePanel series on climate change and health, where we bring together experts from around the world to tackle some of the most pressing challenges of our time. Together, our communities have the opportunity to bridge the gap between scientific research and clinical and public health practice, to bring to the forefront collaborations and solutions where they are needed most. So we hope you will join us for the networking session after this event as we continue to build this exciting partnership. Additionally, we invite you to explore our masterclass series, where leading experts in climate and environmental health discuss emerging research and the scientific basis for this work. So thank you for joining us today. We hope you will enjoy this discussion and look forward to working with you.
Hello, everybody. We really appreciate you joining the symposium this afternoon. We have a stellar lineup of 4 panelists that are going to talk with you about the various risks of climate variability and change for human health and well-being. As we all know, the last year has been characterized by extreme events around the world. Heat waves, wildfires, flooding, and cyclones have been characterizing the lives of so many people around the world, with significant impacts for human mortality and morbidity. We're going to hear more in detail from the panelists in a moment, but first I'd like to introduce the panelists. First, we have Dr. Jane Baldwin, an assistant professor of Earth System Science at the University of California at Irvine. Jane, thank you for joining us today. We then have Jessie Bell. Jessie is the Claire M. Hubbard Professor of Water, Climate, and Health at the University of Nebraska Medical Center. Jessie. We then have Colleen Reed, Assistant Professor of Geography in the University of Colorado at Boulder. Colleen, thanks for joining. And Shubayu Saha, Dr. Shubayu Saha, who's Senior Advisor in the Health and Human Service Office of Climate Change and Health Equity. So thank you very much to the panelists for joining. They're all experts in this area and all have interesting information to share. With that, shall we start with the videos, please?
Hello, my name is Jane Baldwin, and I'm an assistant professor of Earth System Science at University of California, Irvine. I'm a climate scientist, and today I'm going to provide some perspective on how climate scientists both project future climate and what those projections are telling us about how extreme weather events and compounding disasters might be changing in the context of global warming. So, for a little context about the kind of work I do, I use both observations and physics-based climate models to understand the climate system and project future climate. In particular, I work with numerical global climate models that are some of the key tools that are used to project forward future climate, such as in the Intergovernmental Panel on Climate Change reports. These models are physics-based, using fluid dynamics equations discretized over a sphere. And so we can have a fair amount of confidence in their predictions because they are driven by these physical laws. There are also some processes that we need to represent empirically because they exist at scales that are smaller than the scale we are able to resolve with these models. So, as a result of both observing recent events and also interpreting data from these projections, there is growing concern about changes in climatic extreme events with global warming. This concern stretches across a wide range of different types of extreme events. Heat waves, for example, are robustly projected to increase in frequency and intensity with global warming. There's also concern that the most intense tropical cyclones are growing more intense, and wildfires are becoming more frequent and larger. There is less well understood, but still some projections about changes in convective events with climate change, such as lightning and even tornadoes, and also increases in flooding expected to occur with sea level rise and intensifying precipitation. In this panel, we're going to focus in particular on compound disasters, which result from combinations of different events. Compound disasters can occur in space, in time, or across space and time. And compound disasters can consist of either individual extreme climatic events occurring together in some way, again, either across space or across time or simultaneously. They can also, however, consist of smaller anomalies that are extreme in combination. So, for example, slightly elevated heat occurring after a milder storm that still led to a power outage could lead to substantial health impacts. For health, we might also consider climate events that compound with widespread health risks. For example, the COVID-19 pandemic occurring simultaneous with a hurricane. So I'm going to discuss two specific examples of compound events to kind of get your brains going on this topic. One type of compound event we're very concerned will increase with global warming is flooding from hurricanes. Following climate change, sea level is robustly projected to rise. On the left-hand side of this panel, you can see a consensus view of how sea level will change over the next century. If this sea level rise occurs underneath a tropical cyclone, for example, Superstorm Sandy, this exacerbates the flooding from this storm. So tropical cyclones already cause significant storm surge, so flooding onto coasts, but if this is occurring at a higher level of the ocean, this would in turn lead to greater damages. And in fact, a recent study estimated that $8 billion of additional damages occurred from Sandy due to sea level rise. Another type of compound event that I myself have done a lot of work on is heat waves occurring in sequence. And what we find is that heat waves will more frequently occur closely in sequence or compound with global warming. In other words, back-to-back heat waves will occur a lot more frequently with global warming. Here's a schematic illustrating what I mean by a back-to-back heat wave, where the red line is designating a threshold over which a day would be considered extremely hot. And we can see a compound heat wave might be some extremely hot days interspersed with cooler days, followed by more extremely hot days. And indeed, what we find is many of the most impactful historical heat waves exhibited structures like this. We can use climate model projections to see how the probability of this type of event changes with global warming, and what we find is a much larger proportion of heat wave risk in the future will be occurring through these compound days. So, as a climate scientist, I am very motivated to collaborate with health practitioners and researchers because ultimately I think it is collaboration between health researchers and climate scientists that is critical to protect and prepare for the health impacts of climate change. Thank you very much.
Hello, my name is Jesse Bell. I want to talk about the health impacts associated with drought. Drought has shaped our society. I put this quote up here because I think it kind of summarizes drought quite well. Floods kill people, but droughts destroy civilizations. And when we look back in history, we can see that the fall and collapse of certain civilizations are actually, they correspond quite closely with major drought events that have happened and had ripple effects across that potential society. We're very well aware of the impacts that drought has on society. Here in the United States, drought has shaped our country, has shaped the United States in a variety of different ways. When you look back to the Dust Bowl of the 1930s, there was a major significant drought event that hit the central part of the United States. That drought event, the Dust Bowl, then had economic impacts on the United States that led to, partially, to the Great Depression. And then that had economic impacts across the entire world. And drought has been a constant presence within the United States. Right now, here in the United States, we are facing a major significant drought event that is having impacts on society, it's having impacts on us. But as I've mentioned, drought is not always thought of in the context of human health. A lot of times when we think of drought, we think of it in the context of agriculture, water resource management. And that's what this figure kind of illustrates to some extent. This is looking at fatalities that occurred between 2004 and 2013 associated with different climate and weather-related events. And one of the things that you'll notice is drought isn't listed here. Heat waves likely cause more deaths than any other climate or weather-related event. But then when you look over in that gray box to the right, you'll notice that drought is number 2 as far as financial impact, $1 billion lost associated with climate and weather-related events. Drought over that time period had about $80 billion of financial impact, economic loss to the US alone. And we've been seeing more of these types of billion-dollar climate and weather-related disasters, especially over the last 40 years. This is what this figure has been showing, or is showing, that we've been seeing an increase in weather and climate-related disasters in the United States that have had over $1 billion of economic loss or financial impact. And drought is one of those disasters. Over that time period from 1980 to 2021, we had at least $29 billion drought-related disasters that impacted the United States. You can see that pretty much every state was impacted by one of these 29 events. That led to at least $300 billion of economic impact, and also 4,000 deaths, over 4,000 deaths. Most of those associated with heat waves that occurred with those major drought events. This kind of gets at some of the issues of understanding the association of drought with human health outcomes, to human health outcomes. Drought is unlike many other natural disasters Drought is much more slow evolving. The impacts are not immediate. It can require multiple steps before you can actually see a human health outcome. And the way that we've devised or designed health surveillance, it's not really well designed for connecting drought to human health. So these are some of the challenges in understanding those health impacts. But the impacts are there and the pathways are there. Drought events changes the temperature, reduction of precipitation, reduction of snowpack, reduction of runoff and groundwater. Those things can have impacts on the environment, dust storms, more wildfires, reduction of water quality and quantity, increase in heat waves, changes in vector habitat, and changes in food security, which then can lead to a number of human health outcomes. And I just have a few of them listed here. And so the way that I look at drought is very similar to the way that I look at climate change. Drought is a threat multiplier. It has the potential changing the environment in a way that can lead to human health outcomes. Drought can lead to more extreme heat, wildfires, reduction of water quality and quantity, reduction of air quality, changes in vector habitat. These things can lead to human health outcomes. And there's been some studies that have shown that relationship. Berman et al. Showed that there was an increased risk in hospital admissions and mortality in older adults in the western part of the United States with drought events. Abadi et al., that was just published this year, showed that there was an increase in mortality associated with white females and white males between the ages of 45 and 65 years of age in Nebraska. But that doesn't get at the pathway. That doesn't get to understanding what's causing those changes in mortality. And there's a variety of different reasons for it. In 2021, there was a study that showed that groundwater, private drinking wells and private wells, domestic wells, saw an increase in arsenic concentration during major drought events. There was also a study that was published in 2021 that showed that during drought events in farmers and farming communities, you see an increase in reported stress. And actually, during this study, what they found was that the effect estimate of drought was 4 times greater in magnitude than in farmers reporting pain or injuries in other parts of their body. Just kind of illustrates the potential human health impacts that this is having and the complexity of those impacts, but also the significance of those impacts. So with that, there's still much work to be done. We need to better understand those connections between drought and human health. And we need to figure out how to better engage public health and public health departments in addressing and helping address some of these human health concerns associated with drought. There's a lot of need for more research and understanding, monitoring the human health outcomes that are associated with drought, monitoring environmental changes that can lead to human health outcomes, and understand the role of public health departments in this process, and understanding what are the best practices and lessons learned so that we can help share that information with others of facing this issue. Because we are in a changed climate. The drought conditions that we face today are more severe and intense than the ones 50 years ago. And they'll likely continue on that pathway for the next 50, 100 plus years. And so if we're not addressing these issues now, we won't be able to address these issues in the future. And so with that, thank you very much for your time, and I look forward to our discussion.
I'm Colleen Reed, and I'm going to be talking today about extreme heat and wildfire events. And as I was putting this talk together, the Seattle metro area was in the news for experiencing record heat and wildfire smoke at the same time, as well as additional fire danger, meaning that the fires could continue or get worse. And repeatedly, these events are co-occurring. This isn't surprising, as temperature is one of many drivers of wildfire risk. I should note that in addition to the fact that hot temperatures can contribute to an increase in wildfires, you could also have a heat wave occur with smoke coming from far away. So the wildfire could be in the same location, or it could just be that the smoke and the heat are happening at the same time. So now the question is, what do we know about the health impacts of combined heat and wildfire smoke exposures? In 2010, there was a heat wave in Russia that was extreme. There were 44 days long with very high average temperatures, as well as really high air pollution. And they estimated that there were about 11,000 excess deaths during this event, and that more than 2,000 of those could be attributed to the wildfire smoke. And one of the conclusions of the study was the interactions between temperature and PM were more than additive in terms of contributing to deaths. A more recent paper that came out just this year looks at extreme heat and extreme PM 2.5 over a 5-year period. This isn't necessarily in wildfire smoke, but in this case it is, because the way they defined extreme for both heat and PM 2.5 was being among all days across this time period in the 95th to the 99th percentile. And so all of the days that were in the extreme PM 2.5 category were days that were impacted by wildfire smoke. And they found that each of these extremes, either heat or PM 2.5, was associated with significant increased risk of mortality, but their co-exposure had a larger effects beyond the sum of the individual effects. This is very similar to a bunch of other studies that have been done looking at the combined effects of air pollution and temperature that were synthesized by Susan Annenberg and colleagues in 2020, where they found there were enough studies that looked at air pollution and temperature that found a synergistic health effect that they could confidently say that that is the case when you have these two exposures. And that happens regardless of whether the air pollution is from wildfires or not. But the recommended actions for these two exposures can be in conflict. These are both infographics from the Centers for Disease Control. On the left, you see that they say, keep wildfire smoke outside, which means close your windows and try to keep the air from coming inside. They do mention that you should get an air cleaner or a filter, knowing that even when you close things off, some of that air pollution comes inside. To beat the heat, you want to try and stay cool. And so in this case, it talks about how you are going to be safer if you're in a home with air conditioning. But if you don't have air conditioning, the way to cool off the indoor space would be to open the windows, which is directly in conflict if there's also bad air quality outside due to a wildfire. But increasingly, these agencies that provide this information are addressing the combined hazards. This is from the EPA's website, where they do put a link in where you can find out about your local air quality when looking up information about what to do during extreme heat. However, I would note that this website focuses on ozone air pollution, which tends to be higher on hot days, but does not address wildfire smoke. On the EPA's website for what to do with wildfire smoke, they talk about trying to have a clean airspace and using a portable air cleaner or high efficiency HVAC filter. But they do address one thing that can be done if you do not have a portable air cleaner or do not afford a affordable air cleaner, is that you can get a fan and put a filter on it and put a box fan for your window, such that you could have the window open, pull the air through the fan, but try to filter out those particles. And this is actually being increasingly shown to be an effective way to keep your air clean inside. But by using a fan in the window, it is something that can be done in an affordable way to also try and cool off the inside of a home. However, both of these agencies, the CDC and the EPA, also importantly state that if people cannot keep their houses cool, they should not just rely on fans. Air conditioners are better, and if you don't have air conditioning in your home and you don't have a way to keep the air clean, that you should try and find a cooling shelter / clean air shelter where there are high efficient HVAC systems with very good filters that can filter the air as well as cool the building mechanically. But how do we communicate about air quality? We use the air quality index, where there's a variety of colors to tell you what the air quality is outside. How do we communicate about heat? There are excessive heat watches, excessive heat warnings, heat advisories, and sometimes you have to go to different places to get this information. And I think it is very interesting that a recent study was trying to see, is there a way we can combine the air quality index and the heat index in relation to health? In this was an example of a city in Mexico, but I think there needs to be a bunch more research here to see if there's a way to communicate the two together, given that we know that there's a synergistic effect of these exposures. Now, there's various studies that look at which populations are more affected health-wise from either exposure, but I have not seen any that look at the two. Obviously, people who cannot control being outdoors, such as outdoor workers or people experiencing homelessness, are much more likely to be exposed to these two exposures. People who are renters who have lower incomes or fixed incomes might find it harder to keep their homes cool and clean because of having to pay the increased utility bills to cool or clean the air inside their home. And then there are individuals with physiological conditions, such as people over 65 or young children, such that they're more susceptible to both of these exposures.
Greetings, everyone. My name is Shubhayu Saha, and I'm currently a senior advisor to the Office of Climate Change and Health Equity in the U.S. Department of Health and Human Services. While the manifestations of climate change through extreme heat, wildfire, drought, hurricanes, and extreme events impacts one and all, certain communities are much less prepared to cope with the stress associated with these hazards. These are communities that have long faced economic, environmental, and social discrimination that have resulted in chronic resource deprivation, which lies at the heart of concerns around environmental injustice. As a result, the climate hazards compound the challenges posed by current inequities and stressors and make it much harder for certain communities to prepare, respond, and recover from these climate hazards. As an example of how historic inequities amplify the climate-related hazards for some communities, this graphic shows areas in the city of Richmond in the state of Virginia. Using historical property tax maps, areas within the red boundaries were African-American dominated neighborhoods that were targeted with housing segregation policies since the 1930s. These were neighborhoods where individuals could not obtain loans for development and instead became places where industries, warehouses, and poor quality public housing was built. By design, these neighborhoods had a much higher concentration of material that are likely to trap heat. Today, these formerly red line neighborhoods have much less tree cover than areas close by, and consequently are, on average, 5 degrees Fahrenheit hotter on a summer day than green line neighborhoods. This pattern is consistent nationwide across a host of other big cities. Zooming out from the neighborhood to the national, this map shows rates of heat-related emergency department visits across 39 states in the US, representing 85% of the population. The different colors in the map show counties classified by the quartile of rates of heat-related illness. Counties in the top quartile of rates are represented in dark brown. We observe that 31% of the rural counties were in the top quartile of heat-related illness rates, compared to only 8% in the urban counties. So as we consider strategies to reduce the high rates of heat illness in these parts of the country, we need to identify the risk factors that are contributing to these high rates. So for illustration, consider 2 counties that fall in the top quartile of heat-related illness: La Paz County in the state of Arizona and Pike County in Kentucky. This map shows counties in the United States based on the number of extremely hot days, with counties in red being in the top quartile of heat exposure. Both La Paz and Pike, the 2 counties that you saw in the last slide, have relatively high levels of exposure to extreme heat. But when we look at the distribution of potential risk factors to heat illness, the 2 counties show very different profiles. La Paz have high number of residents who allocate a high percentage of income to pay home energy bills and thus are energy insecure. High proportion of families live in mobile homes that are very unsafe during heat waves. The county has relatively low tree cover, and the county ranks very low in terms of overall health conditions. In contrast, Pike County in Kentucky is highly rural. Large number of people are employed in the construction sector and work outdoors in highly exposed conditions. Residents have a high prevalence of diabetes, and the county ranks very low in terms of poor housing conditions. These factors combine to make the residents in both these counties highly vulnerable to extreme heat, but it also highlights that the solutions to reduce the health risks to heat might be very different across these two different counties. So the set of strategies to reduce health risks from heat are expanding beyond public health interventions as we consider the broader range of social determinants of health. The Office of Climate Change and Health Equity are publishing a series of climate and health outlooks in collaboration with National Oceanic and Atmospheric Administration to provide heat-relevant temperature information a month in advance for improved preparedness and response. Centers for Disease Control and Prevention are publishing daily updates on heat-related emergency department visits on the CDC Heat and Health Tracker during the summer months. The human services agencies like the Administration for Children and Families are expanding investments to help low-income families pay for cooling needs in the summer months. Services through Medicare and Medicaid health insurance plans are being expanded in some places to help beneficiaries get fans and air conditioners as medically necessary. And as the new climate investments in energy efficiency, weatherization programs, and in the housing sectors are being rolled out, there is a concerted effort to ensure that they reach communities who need them the most, keeping in mind that these investments will also reduce the health risks from extreme heat in these communities. Thank you so much for your attention, and I look forward to the rest of the webinar.
Thank you to the panelists for really excellent presentations. I appreciate the time and effort you put into those. And I'd like to start the discussion by opening up for questions from each of you to each other. I often sit on panels and think, I would just love to ask a particular question. So does somebody have a question they'd like to ask one of the other speakers? Colleen.
Yes, Jane, thank you for your presentation. And I'm wondering, in addition to the heat waves in sequence, do you know of any studies that have been, or researchers who are working on trying to forecast the risks of compound extreme weather events sort of happening in parallel or concurrently?
Yeah, great question. Absolutely, that's a very active area of research. In fact, the work, I'd say there's, if anything, more work going on right now focused on concurrent compound extremes than ones occurring in sequence. For example, there's been a series of compelling papers recently looking at the risk of having a heat wave following a tropical cyclone. And basically, even if tropical cyclones didn't change at all because heat waves are becoming more frequent, there's a increasingly high risk of this type of compound disaster, which is a particular concern for health because tropical cyclones often cause power, or hurricanes are just a subset of tropical cyclones, often cause power outages, and then that leaves people less able to cool themselves. There's also a lot of interesting work going on that's definitely a topic for debate in the atmospheric science community, but about kind of far range connections between heat events. So for example, if you have a heat wave going on in the eastern US, maybe are there waveforms that make you more likely to have a heat wave occurring in a different place? I'd say the jury's still out a little bit on how robust those results are, but it's definitely something we're actively trying to understand. What's the probability of having multiple heat waves or droughts occurring in different bread baskets at the same time, for example? So, yeah, I could probably spend 30 minutes talking about different types of compound extreme events. So maybe I'll leave it there for now.
That's great, Jane. And I don't understand the technology, but your screen appears frozen on my side. So maybe if you flick your camera on and off, that would be helpful. I don't know. Somebody in
How
the back.
about now?
No, it still seems frozen on my side.
It looks okay to me.
Okay, that's good. Then I'm not going to worry about it. It's just on my side. I'd like to follow up from Colleen's question, and this is to actually several of you. There's growing interest in what's called impact forecasting. So moving beyond forecasting that there's going to be a drought or a flood, heat wave, and to actually integrate the health information. And so instead of there is a heat wave, Shubayu talked about the red line districts. These are the red line districts that will likely be more affected. We know that there's poor health, we know that there's fire exposure, and get down to a more granular level that will hopefully mean that there's better communication on the risks and able to convince people to change behaviors where they need to be able to protect themselves during extreme events. Anybody want to comment on that? I think it's a really important area going forward.
I'll start by citing some work that CDC has been doing with NOAA for the last couple of years, maybe 3 years. At CDC, we were looking at heat epidemiology. We were looking at hospital admissions associated with heat. We definitely couldn't get down to the granular level that you mentioned, Chris, the neighborhood scale, but we looked at different climate regions across US. And we identified the temperature range at which you see an increase in adverse health outcomes, and we looked at multiple health outcomes. And we have shared that information now with colleagues in the National Weather Service, and they are essentially taking that information and trying to recalibrate the way heat warnings are issued, which goes beyond this sort of notion of a binary, way of classifying a heat wave. Yesterday is a heat wave or not, and to move into, what Colleen was sort of showing in terms of, what we've been doing around air quality, into the sort of graduated, system of sort of risk communication. Hopefully, as we, get access to more granular data, maybe sort of, through a variety of, both administrative as well as, syndromic, surveillance data, it will probably give us an opportunity to understand how these risks vary across cities versus rural areas, which are not too far from each other in many parts of the US. I mentioned we see higher rates of heat-related illness in many rural areas compared to their urban counterparts. So, that was, probably something that, worth mentioning, that I guess moves us towards, having more high-resolution impact-based forecasting as we make better use of these data assets.
And I apologize, Jesse, Jane, and Shubayu. On my side, your videos are frozen, so I can't tell if you're interested in intervening. I can't see if you raise your hands. So invite you to just jump in, because it's the only option we got.
I mean,
Sure. Go ahead, Jane.
I was actually going to ask you a question, Jesse, so maybe I'll ask it but you can say what you're going to say too. I was curious, in response to Chris's question, Shubayu's comments, if, let's say you made a very compelling case for the importance of thinking about drought. Let's say we perfectly knew the health impacts of drought across the US, which clearly we don't, but let's say we did. What kind of interventions would that allow us to do? Like, what would we do with that information, in your opinion?
No, that's a great question, Jane. And, and I focused on drought, but obviously, when we're talking about any of these potential disasters, there's the two ends of the spectrum. You could also be focusing on flooding as well. And a lot of times when we talk about the impacts, and this kind of goes back to a little bit of what Shubayu was talking about, we focus a lot on either coastal areas, we focus a lot on more urban areas, but rural areas are a lot of times overlooked in this. And that's some of what our work is actually looking at, and looking into some of those rural areas and how they're being impacted by drought events and other natural disasters. And drought in particular, if we were using that information, well, I'll give an example. We haven't published these results yet, but they're looking pretty clear. We're actually looking at suicide-related deaths associated with drought events. And we find that actually during the staging of drought, whether it's in the early part or in the latter part of the drought, you actually see differences in the number of suicide-related deaths in those different stages. And so this makes me think that there's opportunities in there to work with public health officials, healthcare, and helping them understand the areas where maybe we can come in early
especially with some of this, and make sure that we're providing prevention. We're also providing opportunities for people to understand that there's resources out there to potentially reduce some of these impacts. And yeah, and you know, on the opposite end of the spectrum, when we were talking about the flooding side, for example, there's, you know, and I'll use an anecdotal story first. And so back during the 2019 floods that hit the central part of the United States, these were the costliest inland flooding events in US history. They had significant impacts throughout this region of the United States, the central part of the United States. Nebraska was kind of at the epicenter of it. And those flooding events, or that flooding event, had huge impacts on the rural communities. One, it really didn't make national news until about a week after that flooding event had already taken place. And so we were already, from like a national news perspective, it was kind of missed as far as what was going on. I had colleagues contacting me actually from CDC, asking me if I was okay. And I was like, well, if I wasn't, a week ago, that would have been really bad. But in that same context, if there was more of this early kind of forecasting and providing this information, especially to rural areas for prevention and preparedness, that I think that could be huge. I can use my own parents for an example. I'm from rural Nebraska. And when that flooding event occurred, you saw the responses vary by community. So there is an opportunity to get more of this information out to some of these places for prevention, for preparedness, and for reducing some of these health impacts associated with it. My mom, for example, and maybe she's watching this, but my mom, for example, when the flooding happened, it wasn't really communicated to her where to go during that flooding event. And so she was just driving around, which is, as many of you probably realize, during a major flooding event like that was a unique flooding event and was impacted by climate change, driving around in rural Nebraska while floodwaters are increasing across the state and across the region is a potentially deadly situation. Luckily for her, she was okay, but that just kind of illustrates some of those communications that we need to help continue to build in this area, especially as these things are getting worse.
And one thing I'll add to that, and apologies, Shubayu, I just can't tell if you'd like to intervene, is I think there's ways we can use the information we're gaining on the health side to start thinking differently about the early warning and response systems. For heat waves, we have so much information about groups that are at particular risk, but we don't use that. We have a threshold, a cut point, above which we say people are at risk. But we know that adults over the age of 65, outdoor workers, others are at risk at lower temperatures. And as the skill is increasing in forecasting heat waves, it's also increasing in forecasting other extremes, of using that to start developing a tiered kind of warning system. So 3 days out, saying, we know the temperature is going to be really hot on this particular day. Temperatures are already high enough today that these groups need to start taking action to protect themselves. We know that mortality starts to rise about 24 hours after you start experiencing very hot temperatures, and give people the 24 to 48 hours to start protecting themselves so their core body temperature doesn't rise. So they do take the actions they need to take to protect themselves. And to have family, friends, colleagues look in on those who are most vulnerable. Also for states where there's regulation, there's 4 states in the US that have regulations to protect outdoor workers, to have those regulations kick in. And so there's a lot we can do with this interplay, this intersection between our fields to be much more effective, because we know with climate change, these events are only going to become more frequent and extreme, but we don't have to have people die in them.
I think that's really important, Chris. And I would add that, for air quality, there is that tiered warning it says for sensitive groups, but there's not very good communication to the public about who are sensitive groups. I have asthma, and I tell people that ask me about the air quality, I am a sensitive person because I have asthma. And I've heard people say, oh, really? I have asthma too. I didn't think of myself as a sensitive group. So also about, even if we have this tiered levels of saying, what is very specific, right? If you're over 65, if you have these health conditions, if you're taking these medications, because we know a lot of information about that for specific hazards and putting that into the communication. And then I think also, as related into my presentation, just this idea that sometimes different hazards are happening at the same time, but you have to go to different places to get the information. So trying to think about how we can get that information into ways that are also not just you get it in the same place, but that are effectively communicated. So studying how well people respond when they hear that news or they get that information, and trying to target that information or change the way we communicate it such that people are receiving the information and acting upon it.
And I think we need to add more levels, particularly for the air quality index. An air quality index over about 60 is unhealthy for anyone to breathe. Seattle's been over 100 for 2 weeks. At what point, and there was a community in Los Angeles last year had an air quality index because of wildfire smoke of over 750. At what point do you declare an emergency? And we're unfortunately starting to get that information where the analyses can be done, where we can say this is an emergency and these actions then need to be taken to protect everybody in those situations. Shubayu, I apologize. I just can't.
No, not at all. Not at all, Chris. It was just something that came to mind. Following Jane's question. There are a lot of investments currently happening, through the government, both at the federal level, at the state level as well, that have, I think, poorly been connected to how they are so relevant to climate change and climate risks. Through the human services program, like the low-income home energy assistance program, it's been in existence for a very long time, but only now are we recognizing that it has huge implications as it provides low-income families the scarce resource that they need to maybe keep the fan on or the air conditioner on during heat waves. So, for example, following the heat dome in Seattle in 2021 and Washington State in 2021, this was the first year where the state of Washington used some of the low-income home energy assistance program, which was primarily created to provide assistance for heating, during winter months, for cooling in summer. And so this is how some of these programs are increasingly being. Number one, agencies are realizing that these are really climate-related investments that are currently happening, and we are trying our best to connect the dots so that these agencies realize the very important role that they play. And the agency has a similar program called the Low-Income Household Water Assistance Program, which would be extremely critical as we think about drought, as we think about how that program and the investments through the program happen, particularly in the western and the southwestern parts of the country where this is an emergency. Drought is an emergency. It's been going on for too long. So I think we are trying to, and we need to do a better job in sort of stringing these resources together and making sure that it reaches the the individuals and the families who need them the most.
That's a really good point. And I'd like to add to it, there was something quite recently about the state of Oregon that's going to be using Medicare funds.
That's exactly right. These are Medicaid waivers for Medicare beneficiaries who can use some of that money, some of the dollars, to get air conditioners, home filters, thinking about wildfire smoke and how badly they have been impacted, and hopefully, this would be that example that others need to emulate and expand such benefits too.
Before we get off the topic of impact forecasting, I just wanted to throw in something about my perspective as a climate scientist on this. A concern I have is that a lot of the time it's great that we have so much rich information now about different thresholds that are relevant for different types of groups, and we can marshal that towards better heat warning systems. I think something I haven't seen as much in the literature, though, is we have to think about the predictability of the heat, humidity, or whatever anomaly we're interested in the context of the atmospheric system, because we could you know, often I see studies about atmospheric predictability not framed with a health impact in mind. And I have a feeling there's probably kind of lost specificity there. We could be predicting these things farther out, but we're just, anyway, I think this is an area where more in-depth collaboration between, say, epidemiologists and atmospheric scientists, there's probably some low-hanging fruit there if we just talk to one another and really work together in depth in the development of these warning systems. But yeah.
None of us are going to disagree with you, Jane, on that.
Yeah, of course. Yeah.
It's an enormous opportunity, and I'd like to broaden it a bit. When we think about the kinds of extremes we've been talking about, they're all of society issues.
Yeah.
Jesse was really clear about drought, Colleen about the risks with wildfires. The heat dome's been mentioned in the Pacific Northwest. It happened during the height of our cherry picking season, so lost a significant fraction of the cherry crop, affected the wheat crop. The area between south of Seattle and into Vancouver, BC, is where lots of oysters, mussels, and clams are grown. And with low tide, there was millions of them that were cooked. It was so hot. And that's food security for many of the coastal tribes. And so thinking of the roles that we all have to play and bringing in others that can bring in these very important perspectives to make sure that we address all of the risks. And to continue broadening it out, including the people that are responsible for our infrastructure. In Portland, during the heat dome, there was an assumption that a fair number of people going to cooling shelters would use their light rail system. But the temperatures were so hot, they had to turn off the light rail system. Same thing happened in London this last summer. Rails are tempered to a particular temperature. In London, they were tempered to, 25 or 28 degrees Celsius. Temperatures were 40. So they couldn't use their rail systems, and making sure that we understand our own infrastructure and how responsive it's going to be, whether we can rely on it, and what we can do to help protect human health and well-being. And the last ramble I'll put onto this is we also have to think about mental health. There's growing literature on extreme events and the very significant impacts on mental health and well-being. And Shubayu, it's good to see you. I'm glad that finally started working. And now I'm looking at the link with the questions. There seems to be no questions. We certainly encourage questions from the audience. So please do put your questions in the chat. Otherwise, we're going to continue our discussion here. Would anybody like to pick up one of those threads?
I was going to say that I really liked Jane's comment about, working together on what type of forecast of the hazard is important with the, having the climate scientists and the health scientists working together. However, back to your point, Chris, about, projecting the impacts, I guess one concern I have about projecting the impacts is then if we project the impacts and then we communicate really well and we, prevent the health impacts that we projected, then it might look as though we got it wrong when we would have gotten it right without that intervention. And so I guess I think about working more on the side of, trying to project the hazard or the combined hazards in advance so that we can intervene, and really taking a public health approach to these and intervene and working on the science to understand what interventions are really helpful and what type of communication is going to be really helpful to prevent the health impacts, a little bit more so than trying to project what the health impacts might be.
Well, the seminar that I was in was about forecasting. So it wasn't really projecting. It was doing exactly what you say. Shubayu's published some really interesting, important results of looking at, particularly in the East Coast, of hurricanes and storm surge, and where are the health facilities and which health facilities are in harm's way. And that obviously is important operational information. I remember back in the early days when I started working on climate change issues, someone went to Long Island and went to various hospitals on Long Island and gave them the scenario that there was a major hurricane that hit Long Island. There was flooding, and basically your hospital is going to be flooded. In fact, all of the hospitals are going to be flooded. And where are you going to take your critical care patients? And every hospital said, I'll take it to the hospital down the road. But the hospital down the road is going to be flooded too. There just wasn't the preparedness for real extreme events. And that's one thing we haven't gotten into in much detail is we do have early warning and response systems for many of our hazards, but we're not, in my opinion, really preparing for extreme hazards of thinking outside the box, as it were, of the hazards we've already seen as compared with the hazards we're going to be facing.
This is a very personal reaction, Colleen, but as far as impact forecasts go, my take on it is, I think right now we can't make, good the enemy of the best. And in terms of what we would do if we know that X is going to happen, I think the public health prevention options are not a whole, they are a few. And if we could at least, categorically map that, if your forecast is going to be, a certain level of, adverse outcomes, you do strategy A. If it's more than that, you do strategy B, which I think makes, the whole enterprise useful. It probably takes us away from this. Yes, there would be, the researchers amongst us who would continue to look for precision, who would continue to look for perfection. And I think that is really needed. But, meantime, we may not have the time to wait for that perfection. And, if there is that dialogue, I think that's where, the translation of science into practice becomes really critical. We bring, the scientists who are producing these, the projections of, the impacts, and then to the practitioners to say, what would you find useful? And for us to do that mapping more intensively in more places across more scenarios, I think would lead to, alternatives which are much better than, what we are doing right now.
And that leads to one of the questions that's in the chat. It's about public health programs and interventions that we could look to as models. Or the question is the US the leader? No, the US is not the leader in this space. I would say for heat, and for wildfires. So for heat, London, England's got really impressive heat wave early warning system. It's been around for quite a few years. There's several really good ones in Australia that also focus on wildfires because they've got the same problem as the Pacific Northwest and actually the whole West in terms of heat waves and wildfires. There's lots of places that we can look. There's also places we can look for low and middle income countries. The Global Heat Health Information Network is an international network under the World Meteorological Organization, the World Health Organization, and US NOAA, and has information on people who have developed very effective heat wave early warning systems in India and in other countries. So we do have a long list of examples. I would like to hear from the panelists of other examples.
Well, I think, yeah, Chris, you made a great point. I mean, we're still developing here in the United States, and hopefully we continue to develop. When, we talk about drought, for example, there was some excellent work that was out of Australia that actually first did some of the work showing that there was a connection between suicide and farming and rural communities associated with drought. There's been some work that's come back and looked at that, and I think the relationships are harder to find now. And one of the things that potentially happened in that in between was agricultural assistance programs that took place in Australia that weren't there originally that helped reduce some of the impacts on some of those rural populations. And so I think there's opportunities out there to look at some of these types of events, try to look at these examples and see if there's ways that we can better implement them here in the United States or around the globe. And also just looking back at some of the events that we've experienced and trying to better understand and doing tabletop exercise, understand the impacts and what we could have done differently. Nebraska, for example, and we talked about this a little bit, with that major flooding event that happened in 2019. We saw everything from rural populations having access to care issues for months after the flooding. What was a 1 to 2 hour drive became a 5-hour drive to the hospital. We saw people that had to, that was in some of the tribal communities that had to walk miles to go and try to get to dialysis. We had at least a dozen long-term care facilities that were evacuated due to the flooding. Some of those unnecessarily, but that was partially because of planning and preparedness issues that were in there. And then we also saw hospitals that had damage from the flooding as well. And so I think there's just a lot of lessons that we could be learning from some of these events that have happened, and then projecting out forward, because we live in a changed climate. The impacts are already here, we're seeing them, but projecting that out forward to say, well, what does this look like when it gets worse in the future? Which I know Jane and others have mentioned as well.
And I would underscore, Jesse, one of your points, that public health has taken relatively little benefit from doing stress testing, of doing those tabletop exercises, bringing people together, groups of people together, and giving them a scenario of something in the future that's much more significant than anything they've seen before. And the purpose of the exercise is to work through how you're going to manage it, with a goal at the end of what do we need to start doing now? What are we just not paying attention to? I mentioned, for example, the infrastructure of people just not paying attention to what the constraints are on some of our infrastructure for it being able to function at higher temperatures, and then start incorporating that going forward. There's a project's been running a couple of years in Canada, run by Health Canada, on stress testing. And those results will be coming out later this year, early next year. And I think there's a lot that we can learn about that stress testing and think about how we can build that routinely into what we do with universities in partnership with our health departments to help facilitate this better anticipation of a much, much changed future.
I think this kind of stress testing framework can be very useful in thinking about compound extreme events that are still difficult for climate scientists to quantify the precise probability of. I'm beginning to see papers that kind of take, I mean, in climate science, we often call it a storyline approach, which sounds bad because it sounds a bit like story time, which is, doesn't sound as serious as it is. But rather than maybe you don't know exactly the probability of a Category 4 storm hitting the US in the future, but you can say, okay, let's say a Category 4 storm hit and we had this intensity of heat wave directly after it, while a drought's going on in another part of the country. What does that mean for supply chains? What does that mean for health resources? And, because the reality is, as I'm sure everyone else on this panel knows, there are things we can know about climate change, but there's always going to be some level of uncertainty associated with the variability of the system that even if we had the perfect model, we'd be struggling with. And so I just want to make sure our efforts to prepare the health system aren't stymied by those uncertainties on the climate science side.
And that's one of the reasons to go with the storylines, the stress testing. When you look at the Pacific heat dome, there was a detection and attribution study, and it was virtually impossible without climate change. And there was a real struggle from the climatologists involved that there's a formal process for detection and attribution, and they look at the extremes of the projections, and this was outside the extremes of the projections. From the perspective of the models, this was impossible to happen. It happened. And so it tells us something about models being able to get as extreme as our weather is getting, and to think about then using that kind of information to get the storylines to push out the edges of the possibilities, because we're already starting to face that. Any other comments on this before I go to the next question?
there are quite a few international collaborations around early warning system as well, right? And sort of worth mentioning the Fermin early warning system, the FuseNet, which provides really critical information around food insecurity and other kinds of sort of social stresses associated with long-term drought and famine. So it's not just countries doing that, but a group of countries which have this sort of shared risk of associated with climate change. So it's prudent to sort of share knowledge and share intelligence, in terms of the science that's available, making sure that it really becomes a common good in some ways, so that everybody benefits from the science that is being produced.
Yeah, absolutely. Okay, the other question we have is someone asked for more examples about messaging related to concurrent extreme weather events. And Colleen, you started on that discussion, and Jesse as well. Did you want to add, do you have any examples, more examples you can add about concurrent events and how to message those?
I think the message I would share is that I don't know of ones that have been done well. I think we need to think about those, right? And I think this goes into this idea of, thinking about the unimaginable, right? And how you communicate, right? What if the communication systems were to go down, right? Or what if, like, there's so many other things where we are so reliant on having our energy systems working, right? So, like, for example, with heat waves, right, or air, all of these things that I talked about require energy. And if you don't have that, then we're all in situations where we're going to be hot and have bad air quality. But then in addition, right, what if the cell towers go down, right? So, like, I also think about this in terms of like climate risk plus these other societal things, right? We're going through very high inflation at the moment. So there's this economic extreme event happening. You could have climate risks on top of that. What if you also had, just huge issues with infrastructure? And thinking about that and how you communicate in situations like that, there's a lot there, and I think we need to do a lot more work on this.
Somewhat related to, this is, what CDC did during the pandemic around emergency shelters. Those became really critical, both, during and after hurricanes, as well as sort of extensive wildfires, that we had over those 2 years, continue to have. And, there was quite a bit that was done, providing sort of, simultaneous guidance on, how to, abide by, the restrictions and the regulations that, that were required, keeping the pandemic in mind, but then also sort of realizing that, everybody, needed access to these shelters, during the disasters. And so there was, quite a bit done then. You would find those communications if you go on the CDC's website and, search for COVID-19 and emergency shelters.
Oh, go ahead, Justin.
And I was just going to jump in there because, we think of the climate disasters happening together, but there's also these other natural disasters or other disasters that occur, kind of like the pandemic, the COVID-19 pandemic. 2020, I say this a lot whenever I talk about it. 2020 seems like a really bad year because of the pandemic, but 2020 was also a horrible year when it came to climate and weather-related disasters across the United States. We had a record-setting 22 events that hit the U.S. And so you have these compounding events that happen. And sometimes, we can't just think of climate change in this bubble by itself. We really need to make sure that we're thinking about this, as Chris and others have alluded to, with looking at multiple different types of events and disasters that can be happening simultaneously, some that are unrelated to climate change in an obvious way.
Jane?
This is a slight non sequitur, but it relates to kind of warning systems. I'm curious to those of you who know more about how, the considerations in developing a warning system than me. How do you handle kind of the border cases of, I'm thinking back to the messaging I've experienced myself with disasters. I was in the financial district of New York during Sandy. And if you looked at the map that you were sent, like whether you're supposed to evacuate or not, the building I was in was literally like right at the boundary, you know? And I've heard stories from people. I was at a workshop and was talking to people who dealt with hurricane warning systems in Florida, that there are problems where if they say you should evacuate and then the person does, and then nothing happens to their house, they start to not believe the warning system. So is this sort of just an unavoidable problem? Is this something we can message ourselves out of, like the boy who cried wolf syndrome, I guess?
I think it's a real challenge that public health has been held up to a very high standard. It's expected that public health is always going to be right. Finding better ways of communicating, we're not, right? CDC took an awful lot of flack for how they handled the COVID-19 pandemic. How could they have done it better? There was so much uncertainty. There was so little information, and doing the best they can with the information they have. And so finding much better ways around risk communication. As all of us well know, that most of the research funding has been going into around extreme events of finding thresholds, but not into the risk communication. What does it take to get Jesse's mom to do the right thing during a drought? And we haven't really studied that. And while we're studying that of finding ways to better communicate, there are uncertainties. And there's times when you're going to be wrong. But one thing I will say about CDC is that there wasn't adequate communication of, okay, we may not be right, but if we are right and you do take action, the downside risk is very, very large. And so trying to balance these different kinds of risks is going to be an increasing challenge going forward. And investing more into how to help people understand that, in your case, Jane, of we don't actually know if you need to evacuate or not, but if you don't evacuate, it could be very ugly. And so the prudent course of action is to go ahead and evacuate. And that's the best that we can do. And it seems like on a personal one-to-one basis that humans are pretty good at that. We're pretty good at understanding that maybe yes, maybe no, but something about the official pronouncements have come with a, I think, unreasonable level of expectation of actual precision about that particular warning.
It is interesting. So another anecdote, when the Marshall Fire came through here, the evacuation notice, they had a good job of knowing who to tell to evacuate, and but it all based on, there were two different systems, and one of the systems, it basically just went on which cell tower your phone was using at the time. And so there were lots of people where the cell phone tower was within the evacuation area, but you yourself were not, because it was just about these different systems. And so there were a lot of people who were really upset because they said, I got a notice to evacuate, but then I went online and I saw, oh, I'm not in the evacuation zone. And I agree with you, Chris. It's this whole thing of, people getting mad when, when everyone's just trying to do their best and trying to save lives, really. Right. And I do think that, and it was one of these things where lots and lots of buildings burned down. We had 1,000 homes that burned within a few hours. And yet there were only 2 casualties. Right. So it did save a lot of lives. A lot of people were able to get out in time, and more people evacuated than was needed. But I feel like that's better than having people not evacuate who needed to.
And I think one of the things that hasn't happened, quite as much is, how do we inform the early warning systems with the risk perceptions that individuals have, right? How does an individual in a certain place perceive of a risk? What does a heat wave mean to a person, or what does sort of the risk from wildfire smoke mean to individuals? And I don't know how that information would sort of complement each other, but at least to know that this is what the perception is of this impending risk, I think would help us better warn individuals. And I think that dialogue, that blending of information hasn't quite happened as much as I think we need to.
And I think that needs to be ongoing, Shubayu, that people's
True.
experience changes their risk perception. And so it can't be a study, an academic study, where you go through and say, this is the risk perception, because you turn on the news and there's disasters all around you. You yourself experience one of these extreme hazards, and your risk perception completely shifts. And there has to be ongoing investment in understanding where people stand with risk perception, also understanding where people stand with respect to vulnerabilities, that these large events then increase the overall vulnerability in an area, and taking that into account when thinking about risk communication. There's lots of opportunities to get much, much better in how we talk about large events and make sure that we do protect health and well-being.
I think thinking about how compound disasters can sort of non-linearly add through vulnerability is something that, I mean, I've thought about it a bit, and it's a hard problem, but I hope there'll be more work done figuring out how to tackle that somehow. Because in the work I've done on temporally compound heat waves, you have multiple heat waves occurring in sequence, and you'd expect that the second one, people might be more vulnerable because they're dealing with the first, but at the same time, you have in epidemiology, you talk about harvesting effects. Maybe all the vulnerable people passed away in the first heat wave. It's a difficult problem, but I think important for us to tackle when we keep seeing summers like the one we just had, for example.
Jesse, did you want to jump in here?
I think it was well discussed, and it kind of goes back to what Shubayu was talking about, and Chris, I think you were talking about as well. There is a possibility of fatigue, but with these types of warning systems, but then again, I think there are ways that we could potentially have them more specific, which is, with the heat warning system, having it be at certain designations for certain populations, being like, oh, you're above 65 years of age, you might be more at risk at this temperature threshold, or you have asthma, you're above this temperature threshold, or whatever it may be. But no, I think there's still a lot of opportunity out there to improve this. I mean, at the end of the day, we have to save lives, and hopefully some of this work that we're doing actually does that.
We've got a couple of questions in the chat. I'll take the first one because it's short. Do hospitals look at weather forecasts when studying about staffing needs in ERs? No, not really. The emergency departments have a perspective that they are emergency departments. They're ready for any kind of emergency. I'll use the Pacific Northwest. I'll use Seattle heat dome. And as I mentioned before, with a heat wave, mortality starts within about 24 hours. So emergency departments for the first 24 hours thought they were doing just fine. There was very little increase in people coming into the emergency department. However, after that, there was a 69-fold increase in people coming in for heat-related presentations. And all of our emergency departments in Seattle are coordinated. They've got one group that coordinates them all. And the person in that group said there was a text message he kept from one of the emergency departments that said, we're in crisis. They're getting calls every couple of minutes. There's not good ways to cool people down when people have heat stroke. It's life-threatening. There's very high mortality from heat stroke. It's critically important to get that core body temperature down as fast as you can. And one of the emergency departments, as people came in with these high core body temperatures, put people into body bags and put ice into the body bags to help reduce that core body temperature. And they just about ran out of ice because they hadn't thought that could happen. So there's a lot of space here for the emergency departments to start thinking about how to respond to these kinds of massive disasters when they are overwhelmed. And this is in the middle of COVID, this is in the middle of everything else that's going on. So lots to be done in that space.
Chris, do you know how emergency rooms do anything different when there's a hurricane? Because I can see heat waves, are notoriously undramatic extreme events in their appearance. But I would think if there's, if you're in like Ian, I'm curious if emergency wards would staff more or people go home or what happens.
Shubhaya, do you know the answer to that?
I have one thing I can add, but I'll let Shubhaya launch
Go ahead, Colleen.
So one of my students looked at the way hospitals dealt with Hurricane Harvey in Houston, and she interviewed emergency managers and about what they had put in place because there had been hurricane events like that in Houston previously. So I think that one thing she learned was that the hospitals that had been most affected in previous hurricanes had plans in place. And when the forecasts were coming in for Harvey being really bad, they put those plans in place. In some instances, the plans worked, and in some instances they were better than they had done before, but they still saw gaps and they were trying to address it going forward. So some of them had things in place where, if you were on call when you were once you were called in for that shift, you were coming in for a prolonged shift. And then they were trying, because they knew they wouldn't be able to get in the replacement shift because the roads were going to be blocked, right? There were things that they learned from previous hurricanes that they tried to implement. And I think that that's probably what happened, possibly in the Pacific Northwest, like that heat dome was so unprecedented, right? Versus once they've had that experience, hopefully they learn and they're putting something in place for the next one. But it is this challenge of when that unimaginable event happens that you haven't even thought to plan for. But that was just one thing that she learned in that work in terms of interviewing folks in an area where it was an exposure that had happened before.
I would say something very similar. There's probably some sort of positive institutional knowledge that we gather once we go through these disasters. There were some studies comparing, what happened in Chicago in the 1995 heat wave and then subsequent heat waves, I believe, in 2003 and 2006. And, the general conclusion was that, given everything else, there were lower rates of mortality and morbidity associated with those heat waves. And that's not entirely, because the health systems were better prepared and the hospitals were better prepared. I think as a whole, the city was better prepared. But hopefully there is this sort of institutional knowledge that we gather once we go through these disasters, and then learn from and adapt and replan and redesign these emergency response plans so that the next time such a disaster happens, as a system we are better, more resilient to deal with it.
And I wanted this kind of like taking it back to kind of the original question to some extent. One of the things that we're doing at the University of Nebraska Medical Center, which is also attached with the hospital, the Nebraska Medicine here, is we're actually going through a system-wide climate action plan for the hospital system to understand how, one, like sustainability and doing more active role in that, but also understanding the impacts that climate change can have on the hospital system here. And then the second piece is, what are the potential climate impacts that can be having on the populations that this hospital supports? And understanding who are the most at-risk and vulnerable populations, understanding the climate threats that we face and how that could potentially impact our hospital system as a whole. I'm not sure how many hospitals across the country are doing this, but I think it would be great if more were. So.
No, that's great. And Jesse, it feeds into the last question. We've just got about 6 minutes left of thinking about the inequities, thinking about rural populations, indigenous populations, the poor, the marginalized, who may not have the resources who may have distrust of authorities. And so how challenging it is to communicate with those groups. Part of the answer we know is to use trusted voices. And so thinking about early warning systems, of making sure that they include the trusted voices that those groups will listen to, and having them on board from day one as one develops these kinds of systems. But then there's also, as we mentioned several times, ways to think about using resources. We've talked about federal resources, potentially state resources for people who don't know how to evacuate, but do need medical care, of ensuring that there's ways to bring those people to places where they can get the care that they need while they shelter and wait for the extreme event to pass.
There's also a lot of interest and action in creating resilience hubs. These mean different things for different people, but I think sort of fundamentally, these are facilities. They can be actual infrastructure or sort of virtual networks that are coming up. To support communities. With the sort of overall goal of sort of enhancing welfare. But I think they are increasingly becoming places where people seek shelter and support during disasters, particularly these big natural disasters that we worry about. These are hubs through which a variety of sort of social support activities and programs are being implemented. So maybe we would have more and more of those, and these communities where these particularly are in need for such support, would see more of these resilience hubs opening up and being more active.
And to think about reaching out more broadly than we have in the past. I heard someplace, it wasn't here in the US, of talking about during a particular kind of extreme event. It wasn't a heat wave, but I think it was a flooding event, of training school kids. And each kid was assigned to a particular household, and it was their job to go and convince older adults, people who may not really feel like leaving their house when there's a flooding event, a hurricane, and convincing them that they have to go to the shelter, and make sure that everybody knows where the shelter is, and encourage the children to participate in all of this, because they're often able to get older adults to, for example, get to a shelter when someone else might not be able to. Just have about 3 minutes left, and we've pretty much covered the questions. So everybody gets about 45 seconds to say some kind of closing remark. And I'll take it on the order on my screen, which may or may not be the order on your screen. Colleen, Jesse, Jane, and then Shubayu. Colleen?
I've really enjoyed this conversation, one, I would just say, for myself. But to take away, I think one of my takeaways is just this trying to, I really like this idea of these public health stress tests and trying to imagine the unimaginable and trying to plan for those scenarios.
I agree. Thank you. Jesse?
So I'll have one, I really appreciate this. I appreciate being part of this, but if I had to summarize it, one of the final points I'd really like to make is that role that healthcare has in all of this. And I remember somebody telling me about the COVID vaccine, and they were like, if it was a doctor from the federal government, they probably weren't going to influence you. But if it was your doctor that told you, there is a potential for influence. And I think that's where healthcare can be a part of this. And I remember having conversations with medical doctors here, and they're like, well, why should I be concerned about this? And I'm like, and they're like, some of my patients aren't going to be alive in 20, 30 years. And I'm like, well, climate change is impacting your patients now. And we need to understand some of those vulnerabilities that they have, and helping educate healthcare and being a part of the solution for this problem as well.
Yeah, thank you. Jane?
Yeah, no, this was great. I'm glad I got to ask a bunch of questions myself. I guess one thing we didn't touch on that much, but I don't know. We were kind of debating the role, the importance of quantitatively projecting impacts or forecasting impacts. And I think, there is the need for that kind of work perhaps to motivate warning systems, but it also factors into larger considerations about how much money should the world be investing to prevent climate change. So I think that's another side of this coin we haven't really mentioned. The other thing I wanted to say is I've been thinking a lot about how we project the impacts of heat and the role of humidity in that. And what that's really made me appreciate is that a careful physiological understanding of how climate and weather filters through the human body to result in adverse impacts is really needed to ensure we're accurately projecting future health outcomes of climate change. So for all the doctors in the audience, I think more conversations with you is better. So thank you for attending and hope to talk more.
Great point. Thanks, Jane. Shubayu?
First, thank you, Chris. Thank you to the panelists and everybody who listened to us. I think we just have to, figure out how we can listen to people better. Those who we consider to be vulnerable, those who are actually facing these disasters are the experts who we need to learn from. And, we just have to be better at this. Thanks.
And I want to thank all of you. This is absolutely brilliant. Really appreciate all of your insights. We obviously could have talked even longer. There's other topics, as Jane said, that we didn't start to cover, but a good place to start more discussions. We hope that the audience will use this information to start their discussions in their own institutions, their own countries, and the next time we have this conversation, we'll have more information. So thank you very much.